Good day, my name is Paul Jarrett. I'm an orthopaedic surgeon and hand surgeon, and I would like to talk to you about hand and wrist ganglions. Now, a lot of people come in to see me who've developed bumps somewhere on their wrist and their hands, and of course there's a number of different reasons you could have bumps on your hands and wrists, but ganglions are quite a common one. And what a ganglion is, it's a collection of fluid coming either from a joint or from the lining of a tendon, and that fluid and the bubble basically forms a bulge. Some of the time it's simply there and noticeable. Some of the time it's there and it can be painful. And of course, there are some people who've got ganglions inside and they don't even know about it. So there was a recent study where some doctors went out and they've got a lot of people who had no problems or abnormalities with their wrist at all, and they put them through an MRI scanner and found about 15% of people had a ganglion they didn't even know about. So I've got a picture here, and this is a picture of someone's wrist, and you can see there's a bump there. That's a typical position for most people with a dorsal wrist ganglion, just there. And a few other places where you might find them is this area here in your wrist, or they're not uncommon just over the top of this end joint of a finger, and that's associated with arthritis usually, or mild arthritis for that joint. And another very common place is at the base of your finger, and those ones which we call pearl ganglions are quite problematic in terms of when you grip things like a steering wheel or a gear stick. Little ganglion there often will cause you discomfort. So if you've got a ganglion and you come and see me, the first thing we're going to do is have a look at your wrist to try and work out what is it a ganglion. And then also, particularly if you have pain or problems with your wrist as well as a bump, are the pain and problems associated with a ganglion, or is it that actually you've got a different problem causing the pain and the symptoms of your wrist, and it just so happens that you've got a ganglion as well? So I'll perform an examination of your wrist. We'll try and work out whether it's a ganglion. At times, we may perform further investigations such as x-rays looking for arthritis or some ligament problems, or an MRI or ultrasound to try and define what the cause of the pain might be. Now, in terms of the ganglion itself, what are the options to treat that? Well, there's three main options. One is simply to leave it alone. There's lots of people who've got a ganglion who the ganglion doesn't cause them a problem, and most of the time we'll leave that alone. And if you look at people who've got a ganglion who leave it alone, a portion of people find the ganglion actually disappears. So over 10 years, about half of people's ganglions disappear from their wrists. It's less so from the one in the fingers. Another option is to stick a needle into the ganglion and suck the fluid out. And that's good in so much as it's a very small treatment and not terribly involved and not terribly risky. But the disadvantage of that is it's quite common for it not to work. In fact, most of the time it doesn't work. 90% of the time the ganglions simply come back. And then a final option, or another option, is for us to do an operation and simply remove the ganglion. And there's two ways we can do that. Either we can make a little wound and remove it, and particularly in the fingers, that would be the way we would do it. And then in your wrist, we can either do it with a small wound, or much more common in these days, using some very small wounds and putting a telescope in so that we can have a look around your wrist to look for other causes of pain, and also take the ganglion out through the telescope. And it seems to be that if we take it out through a telescope, that it's less likely to come back, because one of the main risks of doing an operation is a ganglion still can come back. So just as once upon a time you never had a ganglion and one formed, if we take the ganglion away, it's still possible for another one to come back. And if you look at people who've had a wrist ganglion removed surgically, about 1 in 10 people find that the ganglion returns within a year. And then, of course, that's very unfortunate because you've had an operation, you've got some form of scars, and the ganglions come back. So it's not always a clear-cut thing, having a ganglion removed. And of course, if we take a ganglion out, there are a few other risks, such as infection or injury to structures in there, although that's very uncommon. And of course, there's a bit of a recovery time. But most people find when we take a ganglion out that within a couple of weeks they're using their hand fairly well, and usually within a month they're near enough using it normally, although it takes a few weeks to recover completely. So I hopefully have given you some insight as to what a ganglion is and what sort of treatments and thought process are involved in looking after you if you've got a ganglion. I'm looking very much forward to coming to the clinic and seeing you then. Thank you.